Your period is late, and immediately, right away, the first thing everyone asks, are you pregnant? But here's the important thing to understand. A delayed period doesn't automatically mean pregnancy. There are actually dozens of possible reasons why your period might be late. Today, we're exploring all the real possibilities and helping you understand what your late period might actually mean for your health. First, let's clarify. Normal cycle length varies significantly. Most people have cycles between 21 and 35 days. If your cycle is usually 28 days and it's day 32, that's still completely normal variation. But if your cycle is usually 28 days and you're at day 45 with no period, that's delayed. Late is subjective and depends on your normal pattern. Some women naturally have longer cycles. 35 days is normal for them. Others have 24-day cycles. These are individual patterns. When we talk about delayed periods, we mean a change from your personal normal, not from some universal standard that applies to everyone. Let's acknowledge the very obvious first. Yes, pregnancy can absolutely cause a delayed period. When you're pregnant, your body stops shedding the uterine lining. Menstruation doesn't occur at all. This is often one of the first signs of pregnancy that people recognize. But it's critically important to understand clearly, pregnancy is only one possible cause among very many. Yeah, if you've had unprotected sex within the last 2 weeks, pregnancy is definitely possible. If you're sexually active and your period is delayed, a pregnancy test makes complete sense. Modern pregnancy tests are highly accurate, detecting the hormone HCG produced by pregnancy. A positive test is very reliable. A negative test is also very reliable if taken correctly and at the right time. But if pregnancy isn't the cause, if you tested negative, or if pregnancy isn't applicable to your situation, there are many other explanations for your delayed period. This is critically important to understand because many people panic, assuming pregnancy is the only possible explanation for delayed periods. And stress is probably the single most common cause of delayed periods in women. Chronic stress elevates cortisol significantly, which directly suppresses reproductive hormones. Your hypothalamus, the part of your brain controlling your cycle, responds to stress by delaying or completely stopping ovulation. No ovulation, no period. This is completely reversible once stress decreases substantially. Significant weight changes cause delayed periods very commonly. Whether weight loss or weight gain, rapid body composition changes disrupt hormone balance significantly. Your body responds to extreme weight change by interpreting it as a potential survival threat. It pauses reproduction. Weight changes from dieting, exercise changes, or medical conditions can all delay periods. Extreme exercise is another major cause. Athletes sometimes experience amenorrhea from intense training. Your body interprets excessive exercise and overtraining as a potential survival threat. It shuts down non-essential functions like menstruation. This is reversible when exercise patterns normalize. Thyroid disease very frequently causes period delays. Both hypothyroidism, low thyroid, and hyperthyroidism can disrupt menstrual cycles significantly. Thyroid hormone affects your entire endocrine system profoundly. Thyroid disease is easily testable and highly treatable. Simple blood work identifies thyroid issues. PCOS, polycystic ovary syndrome, commonly causes irregular or delayed periods. With PCOS, hormone imbalance prevents normal ovulation, leading to irregular cycles. PCOS is manageable but requires proper diagnosis and treatment. Irregular periods are often the first sign of PCOS. Look at manampumbi sand, demripalan, denza volsons dirambalin and hypoduregs. Look at manampumbi sun gondavangd. If your sleep has changed recently from work stress, travel, a new baby, or other reasons, this can delay your period. Normalizing sleep patterns often normalizes your cycle quickly. Look at mandambuan dandri sampling nidin. Restrictive eating, sudden dietary changes, or nutritional deficiencies can delay periods. Your body needs adequate nutrition to ovulate properly. If you've changed your diet significantly recently, this might explain delayed periods. Travel and time zone changes can delay periods temporarily. Your circadian rhythm affects hormone production directly. Traveling across time zones or changes to your schedule can disrupt your cycle temporarily. This usually normalizes within 1 to 2 cycles. Caffeine or alcohol changes can affect cycles in some people. While the effects are usually minimal, dramatic changes in consumption might contribute noticeably. Smoking or changes in smoking can affect cycles. Environmental toxins or new exposures might affect hormonal balance. Seasonal changes affect some people's cycles noticeably. Light exposure influences hormone production significantly. Changes in seasons can shift cycle timing for some women. Most people adapt quickly, but initially cycles might shift. Thyroid disease causes cycle irregularity and delays commonly. Hypothyroidism is very common and highly treatable. Hyperthyroidism also disrupts cycles significantly. Pituitary disorders affect hormones controlling your cycle directly. Conditions like prolactinomas cause elevated prolactin, which suppresses reproductive hormones. These are identifiable and treatable. Ovarian cysts can disrupt normal cycling. Most are benign and resolve without treatment, but they can delay periods. Endometriosis affects menstrual patterns, sometimes causing delays. Uterine fibroids can affect cycle regularity noticeably. Diabetes, both type 1 and type 2, can cause cycle irregularities. Certain medications cause delayed periods commonly. Antipsychotics, antidepressants, and hormonal medications can affect cycles. Antibiotics sometimes interfere with hormonal contraception effectiveness. Some cancer medications affect cycles significantly. Corticosteroids and blood pressure medications can influence cycles. Polycystic kidney disease, liver disease, and kidney disease can affect hormone metabolism, delaying periods. Inflammatory conditions like lupus or celiac disease can disrupt normal cycles. Infections, whether current or recently resolved, can noticeably delay periods. Even the common cold can temporarily affect your cycle. One delayed cycle lasting a week or two usually isn't concerning or alarming. Bodies are naturally variable. Cycles sometimes shift slightly. If you usually have regular periods and you're 1 week late but otherwise feel fine, observation is reasonable. Most cycles resume naturally within a few days to 2 weeks. Several delayed cycles in a row might indicate something worth investigating, but it's not an emergency. If you've experienced significant stress, diet changes, exercise changes, or travel recently, delayed periods might be your body's normal response. These typically resolve themselves when the stressor resolves. If you haven't had unprotected sex and pregnancy isn't possible, and you feel physically fine overall, delayed periods usually don't require urgent evaluation. However, they do warrant attention. Understanding why your cycle has changed helps you manage your health. Ignoring the change isn't helpful. Investigating helps. Take a pregnancy test if and only if you've had unprotected sex within the last 2 weeks, your period is late, and you could potentially be pregnant. You're experiencing symptoms you think are pregnancy related. Tests are most accurate after a missed period. Taking a test too early might give false negatives. Home pregnancy tests are highly accurate when used correctly. False positives are extremely rare. If you get a positive result, you should confirm with a blood test and see your doctor immediately. If you get a negative result and your period still hasn't come after another week, retest or see your doctor. If you are not sexually active or use contraception reliably, pregnancy testing might not be necessary. Focus on other possible causes instead. If you are uncertain about contraception effectiveness, testing is reasonable for peace of mind. There's no harm in testing, even if pregnancy seems unlikely. The certainty is worth it for your peace of mind. You should definitely see a doctor if your period is more than 3 months late, your periods were regular, and suddenly become irregular. You have other symptoms alongside period delay, weight changes, fatigue, hair loss, unusual bleeding. You're concerned about pregnancy. You think you might have PCOS or thyroid disease. See a doctor if you've had recent stressful events and your period is delayed. Your doctor can help manage stress and monitor your cycle. See a doctor if you've changed medications recently and your period is delayed. Your doctor can determine if medication might be the culprit. See a doctor if you have heavy bleeding when your period finally comes. See a doctor if you have severe pain with delayed periods. See a doctor if you're trying to conceive and your cycles are irregular. They can help identify ovulation timing. See a doctor if you simply want answers and understanding about why your cycle changed. Your doctor can order blood work to check thyroid function, hormone levels, and other factors. Simple tests often reveal the cause. Understanding exactly why helps you manage your health better. First, delayed periods are very common and occur quite frequently. Most women will experience this at some point. Second, delayed periods usually have very explainable causes. Stress, weight, exercise, medications, medical conditions, these are all identifiable. Third, most causes of delayed periods are manageable or reversible. Yuning known. If you're stressed, reducing stress helps restore cycles. If weight changed, stabilizing weight helps restore cycles. If exercise changed, adjusting exercise helps restore cycles. If thyroid is the issue, thyroid medication helps restore cycles. If PCOS is the cause, PCOS treatment helps restore cycles. The key point, understanding the cause allows you to address it. Fourth, your cycle is a vital sign. Changes in your cycle reflect changes in your health or environment. Delayed periods are feedback. They're telling you something shifted. Listening to this feedback carefully and investigating helps you understand your body. Fifth, delayed periods don't mean you've done something wrong. They're not punishment. They're your body responding to factors. Approaching your delayed periods with curiosity rather than panic helps. A delayed period doesn't automatically mean pregnancy. It might mean stress, weight changes, exercise changes, thyroid issues, PCOS, medications, infections, or dozens of other factors. Understanding all the possible causes helps you investigate thoroughly and find answers. If pregnancy is possible, test and confirm with certainty. If pregnancy is completely ruled out, look at other factors systematically. Track your stress, weight, exercise, sleep, diet, and any symptoms. This information helps your doctor identify the cause. Your cycle is feedback about your health. Listen to it carefully. A delayed period is your body clearly communicating. It's saying that something changed. Whether that's pregnancy, stress, illness, medication changes, or environmental change, your period is telling you to pay attention. Pay attention carefully. Understanding your body thoroughly is the first step to protecting it. Important medical disclaimer. This content is educational and does not replace professional medical advice, diagnosis, or treatment. Delayed periods can have many different causes. If you're concerned about a delayed period, consult with a qualified healthcare provider for proper medical evaluation and professional diagnosis.